Medicaid, it's a safety net, a lifeline for millions of Americans. For many, it's the difference between life and death, between hope and despair. It ensures that the most vulnerable among us, children, the elderly, people with disabilities, have access to essential healthcare services. Without Medicaid, countless families would be left to navigate the treacherous waters of medical expenses alone, often leading to financial ruin and deteriorating health. Medicaid is more than just a program, it's a promise. A promise that no matter your income or background, you deserve access to the medical care you need. It's a cornerstone of our social contract, a testament to our collective commitment to care for one another. But now, this lifeline is under threat. Proposed budget cuts could slash billions from this vital program, jeopardizing the health and well-being of millions. The consequences could be devastating, not just for those who rely on Medicaid but for our society as a whole. These cuts are not just numbers on a balance sheet, they represent real people, real families, real lives that will be irrevocably altered. By stripping away healthcare, we strip away hope. We strip away dignity. These cuts are short-sighted, prioritizing short-term savings over long-term well-being. They ignore the human cost of denying healthcare. They fail to recognize that a healthy society is a prosperous society. When we invest in healthcare, we invest in our future. We invest in the potential of every individual to contribute to our communities, to our economy, to our shared prosperity. Medicaid is not just a line item in a budget, it's a lifeline that supports the health and dignity of millions. It's a reflection of our values, of our commitment to care for one another. We must protect this lifeline, not just for those who rely on it today, but for future generations. The fight to save Medicaid is a fight for our collective future. It's a fight for the health and well-being of our communities. It's a fight for the promise that everyone deserves access to essential medical care, regardless of income or background. We must stand together, united in our commitment to protect this vital program. We must raise our voices, advocate for those who cannot advocate for themselves, and ensure that Medicaid remains a lifeline for all who need it. Because when we protect Medicaid, we protect our communities, we protect our future, we protect the promise that everyone deserves a chance to live a healthy, dignified life. But these cuts threaten to shatter that promise. They threaten to undermine the very foundation of our social contract. We cannot allow that to happen. We must act now, before it's too late. These cuts are not just numbers on a balance sheet. They represent real people, real families, real lives that will be irrevocably altered. By stripping away healthcare, we strip away hope, we strip away dignity. These cuts are short-sighted. They prioritize short-term savings over long-term well-being. They ignore the human cost of denying healthcare, and they fail to recognize that a healthy society is a prosperous society. By stripping away healthcare, we strip away hope. We strip away dignity. These cuts are short-sighted. They prioritize short-term savings over long-term well-being. They ignore the human cost of denying healthcare, and they fail to recognize that a healthy society is a prosperous society. Who stands to lose the most? In times of crisis, it's often the most vulnerable who bear the brunt of the impact. The most vulnerable among us, low-income families. These families already struggle to make ends meet, and any additional burden can push them over the edge. Children, pregnant women, the elderly, people with disabilities. These groups often have specific healthcare needs that require consistent and reliable access to medical services. Millions rely on Medicaid for their healthcare needs. Medicaid provides a lifeline offering essential services that many cannot afford otherwise. ACA expansion beneficiaries face an uncertain future. The Affordable Care Act expanded Medicaid to cover more people, but now that coverage is at risk. Work requirements could create insurmountable barriers. These requirements often don't take into account the complexities of people's lives. Many work multiple jobs, lack transportation, or face childcare challenges. These obstacles make it difficult to meet stringent work requirements. Losing coverage means losing access to essential care. For many, this could mean the difference between managing a chronic condition and facing a medical crisis. Simplified enrollment processes are also on the chopping block. These processes are designed to make it easier for people to get the coverage they need. These processes streamline access for those with complex lives. Without them, navigating the system becomes a daunting task. Eliminating them creates confusion and delays. People will struggle to understand the requirements and may miss out on critical coverage. It forces people to navigate bureaucratic mazes. These mazes can be overwhelming, especially for those already dealing with significant life challenges. And let's not forget undocumented immigrants. They often live in the shadows, with limited access to healthcare. Many states provide limited coverage through state-funded programs. These programs are a crucial safety net for those who fall through the cracks. Federal cuts could force states to make impossible choices that pit compassion against fiscal responsibility. The stakes are high and the consequences could be devastating for millions. Children are particularly vulnerable. Medicaid covers nearly half of all births in the U.S. It provides essential services like vaccinations, well-child visits, and treatment for childhood illnesses. Cuts would have a profound impact on their health and well-being. Early childhood is critical for development. Access to healthcare ensures children can thrive. It prevents and treats illnesses. It addresses developmental delays. It gives children a healthy start in life. Without Medicaid, many children will fall through the cracks. They will miss out on routine care. Their health will suffer, and the consequences will be felt for years to come. Investing in children's health is investing in our future. Pregnant women rely on Medicaid for prenatal care, childbirth, and postpartum care. It ensures healthy mothers and healthy babies. But cuts threaten to undermine maternal health outcomes. Prenatal care is essential for identifying and managing complications. It promotes healthy pregnancies and reduces the risk of preterm birth and low birth weight. Postpartum care is equally crucial. Cuts to Medicaid would force mothers to delay or forego necessary care. This could lead to more complications, higher maternal mortality rates, and poorer infant health outcomes. We cannot afford to compromise the health of mothers and babies. The elderly and disabled stripping away dignity. Medicaid is a lifeline for the elderly and disabled. It provides essential services that many families rely on to ensure their loved ones receive the care they need. Without Medicaid, the cost of long-term care would be prohibitive for most families. It provides long-term care services, including nursing home care and home-based care. These services are not just about medical needs, they encompass emotional and social support, which are crucial for the well-being of the elderly and disabled. These services are essential for maintaining dignity and quality of life. They allow individuals to live with respect and independence, surrounded by their loved ones and familiar environments. Nursing home care is expensive. The average cost can run into thousands of dollars per month, a burden that most families cannot bear without assistance. Medicaid helps families afford this care when they can no longer provide it themselves. It ensures that the elderly and disabled are not left without the support they need. Home-based care allows seniors and individuals with disabilities to remain in their homes. This type of care is often preferred, as it provides a sense of normalcy and comfort. Cuts to Medicaid would decimate these services. The impact would be devastating, leaving many without the necessary care and support. Families would struggle to afford care. The financial strain would be immense, forcing difficult decisions and sacrifices. Seniors and individuals with disabilities would be forced into institutionalized settings. This would strip away their independence and dignity, placing them in environments that may not be conducive to their well-being. This is not just a healthcare issue, it's a human rights issue. Ensuring that the elderly and disabled receive the care they need is a matter of compassion and justice. We must protect these vital services to uphold the dignity and rights of all individuals. Healthcare on the brink, a system in jeopardy. Medicaid is a vital part of the healthcare system. It supports hospitals, clinics, and healthcare providers. Cuts to Medicaid would have a ripple effect throughout the system. Hospitals rely on Medicaid reimbursement for treating low-income patients. Cuts would strain hospital budgets, forcing them to reduce services or even close. This would disproportionately impact rural and underserved communities. Clinics and community health centers would also feel the pinch. These facilities provide essential care to underserved populations. Cuts would limit their ability to serve those most in need. States under strain, a patchwork of uncertainty. Medicaid is a federal-state partnership. States administer the program and contribute to its funding, but federal cuts would shift the burden onto states. States would face impossible choices: raise taxes, cut other essential services like education, further reduce Medicaid benefits. These decisions would have far-reaching consequences. The result? A patchwork of Medicaid programs across the country. Some states would manage to maintain services, others would be forced to make drastic cuts. This would create a healthcare lottery based on zip code. The economic fallout, a false economy. Proponents of Medicaid cuts argue that they are necessary to reduce government spending, but this is a false economy. Cutting healthcare costs money in the long run. When people lose access to care, their health deteriorates. This leads to more expensive emergency room visits, hospitalizations, and long-term care needs. It also reduces productivity and workforce participation. Moreover, cuts to Medicaid would result in job losses in the healthcare sector. Hospitals, clinics, and nursing homes would be forced to lay off workers. This would further depress the economy. A call to action: our health, our future. Medicaid is at a crossroads. The decisions we make today will have lasting consequences. We can choose to protect this vital program, or we can choose to dismantle it. We need to speak out against these harmful cuts. Contact your elected officials, share your stories. Let them know that healthcare is a right, not a privilege. The future of our healthcare system hangs in the balance. We must act now to protect Medicaid and ensure access to quality, affordable healthcare for all. Our health, our future depends on it.